Colon and rectal cancer right now is one of the most dangerous diseases all around the world. Today I'm going to help you a lot with the information that I can provide you. What is the best vitamin that can help you to reduce risk of colorectal cancer? The best vitamin for preventing colon cancer is vitamin B9. It exists in two types, folate and folic acid. Folate is found naturally in the food sources, and it also is known as folacin, folic acid, or peroglutamic acid, or PGA. Folate is considered a brain food and is needed for energy production and the formation of the red blood cells. It also strengthens immunity by aiding in the proper formation and functioning of the white blood cells. Because its function as a coenzyme in the DNA and RNA synthesis, it is important for the healthy cell division and replication. It is involved in protein metabolism and has been used in the prevention or treatment of folic acid anemia. Because this vitamin is so good for the colorectal cancer, about that a little bit later. We must know, and you must know, when you take vitamin B9, it's going to help you a lot with relieving symptoms and diseases like psychological character. This is stress, anxiety and depression. You will resolve with the good quality vitamin B9. People with Alzheimer's diseases who received supplementation folic acid 1.25 milligrams a day for the 6 months had better cognition compared to a group of similar patients who did not get any kind of supplements. Folic acid may reduce inflammation, which is associated with Alzheimer's disease. Folate may be the most important nutrient in regulating homocysteine levels. Homocysteine is an amino acid that is naturally formed in the body as a result of breakdown of another amino acid, methionine. In recent years, high level of homocysteine has been found to be associated with increased risk of atherosclerosis. This means when you take vitamin B9, you reduce risk of the stroke and the heart attack. Also, number 1 and number 2 causes of death in the world, what is very good information. In order for this conversation to take place as it should, the body needs an adequate supply of folate as well as of vitamin B6 and B12. Homocysteine levels in the red blood cells have been shown to have an inverse relationship to levels of those 3 important vitamins. This is, the lower levels of those vitamins, the higher the level of homocysteine. Folic acid may help you reduce risk of stroke. People who take in blood pressure lowering medication were randomized to folic acid 0.8 milligrams a day or none. Those getting the blood pressure drugs and folic acid had significantly decreased in development of stroke. Colon cancer is the second most common cancer in country all around the world, and right now, and this is very well researched, vitamin B9 has very strong anti-cancer properties. That means when you want to prevent this serious disease, you need to take good quality food that is in high concentration of vitamin B9, take high quality B9 supplements. Also, you must take into consideration, because you need to be sure to take together a vitamin B9 with vitamin B6 and B12, because together they work great in the body. It plays a role in the production of neurotransmitter, such as serotonin. Another important recommendation: zinc and vitamin C play a key role in the decomposition of the vitamin B9 in the body. So you need to take them together. That means if you take high quality food with vitamin C, also with the zinc and vitamin B9, you get a very good composition that is going to be a great health benefits together in the body. So you need to remember this: zinc, vitamin C and vitamin B9 is going to help you a lot in reducing risk of the colorectal cancer. Colon cancer is one of the most common types of cancer worldwide, but also among the most preventable with the right lifestyle, nutrition and immune support. Increasing scientific and traditional evidence supports the use of certain medical plants that may enhance the body's natural defenses, regulate inflammation and support detoxification, all of which are key in reducing cancer risk. Among those are Arbor Vitae, Mistletoe and Suma root stands out for their immune modulating and potential anti-tumor effect. First, I'm gonna recommend you Arbor Vitae or Thuja occidentalis, common name white cheddar, northern white cheddar. Traditional use: immune stimulation, respiratory infections, and wart treatment in herbal medicine and homeopathy. Thuja contains volatile oils, flavonoids, and polysaccharides that stimulates the immune system and may promote apoptosis, natural cell death in abnormal cells. It is not a direct anti-cancer treatment, but acts as immunostimulant and antiviral agent that may contribute to the cancer prevention. Recommended dosage: use only in homeopathic dilutions, 5 drops twice a daily. Not suitable for teas or crude extraction due to toxicity risk or high doses. Caution: use only under the supervision of qualified practitioner. Thuja can be toxic in the large amounts and should not be consumed in its raw or essential oil form. My second recommendation is Mistletoe or Viscum album, common name European mistletoe. Traditional use is widely used in anthroposophic oncology as a supportive therapy in cancer treatment. Mechanism of action: mistletoe contains lecithins, vixothins, and flavonoids that have shown immunomodulatory, cytotoxic, and anti-angiogenic effect. It is commonly used in Europe as an injectable extract to support cancer patients during and after chemotherapy or radiation. Potential benefits: activates natural killer cells and the T lymphocyte, inhibit blood vessels formation in tumors, improves quality of life and reduce chemotherapy side effects. Recommended dosage: injectable form only under medical supervision. Oral use is not advised unless it is specifically formulated. Caution: mistletoe is potent and should not be only used under clinical guidance, especially in the cancer-related protocols. And my third recommendation is going to be Suma root or Favia panniculata. Common names are Brazilian ginseng. Traditional use: used in South American herbalism to boost energy, immunity, and the hormonal balance. Suma is classified as adaptogen, helping the body resist physical, emotional, and metabolic stress. It contains beta-excidosterone and trace among germanium, both associated with cell regeneration, oxygenation, and immune support. Important mechanism in cancer prevention. Recommended dosage: powder root 1 to 2 grams daily, mixed in the juice, smoothies, or tea. Capsules 500 to 1000 milligrams once to 2 times daily. Tincture 2 to 4 milliliters per day. Recipe: Suma Immune Tonic. 1 tablespoon of Suma root powder, 200 milliliters warm water or almond milk. Optional: pinch of cinnamon and 1 tablespoon of raw honey. Stir it well and drink it once daily, preferably in the morning. Preventing colon cancer involves more than 18 risk factors. It also includes supporting the body's internal defenses. Arbor Vitae, Mistletoe, and Suma root each offer unique and powerful ways to aid in prevention, particularly through immune support, inflammation regulation, and cellular protection. Those who don't know this and want to prevent colorectal cancer, Most adults need 400 micrograms of folate 2 times a daily, but daily requirements increase for the pregnant or nursing woman who needs 500 micrograms a day. To prevent colon cancer, you should also take calcium 500 milligrams 2 times daily, magnesium 200 milligrams 2 times a daily, vitamin D 1000 to 2000 international units every day, and coenzyme Q day 10-19 milligrams daily. This is my recommendation that is very well studied in studied research and help a lot of people, just because this is one of the most serious diseases around the world.